Does a facelift make the face look too stretched or cause that slightly pulled mouth to the side? This is one of the main questions from patients who come here to the clinic and want to have a facelift, a deep plane lift with us. And today I'm going to clarify for you what modern facelift techniques can do to help patients and how our three-dimensional facial rejuvenation protocol works. I'm Dr. June Farbari, a plastic surgeon. I live in Criciúma, Santa Catarina, and I've been working in plastic surgery for over 18 years. I brought a question that a patient asked me during a consultation that took place this afternoon. She asked me, "Doctor, I had a friend who had a facelift and ended up with that stretched face and a pulled mouth. Will I end up like that too? I really want to improve, but I'm afraid of the result and of ending up with an artificial look." So this is a question that many patients have, and it happens because of the old results from the older techniques that were used in facelift surgeries, right? In the past, we used to do, plastic surgeons in general used to perform the skin technique, which is a method where you separate the skin and simply pull it back. When you pull only the superficial outermost layer, just at the very skin level, what precisely happens then? You inevitably end up creating that artificial, unnatural effect, and automatically the visible scars become much more noticeable and regrettably end up looking significantly worse after the complete healing process has taken place. So what happened then? Because of these limited results, we started to improve facial lifting techniques. After the skin technique, the SMS plication techniques came along. So the surgeon would separate the skin and then would pass a suture through this area. You know when we do that gathering stitch on clothes? So they would pass a suture to do something like that, anchoring it in a firmer area like the fascia, and then they would pull this suture. And then you would pull the SMS from underneath the skin. Automatically, you would improve the structures a bit, you would reposition tissue. It produced quite interesting results for patients with thin faces, for patients who don't have a lot of excess volume, who didn't have much weight in the face. So for these patients, SMS plication still works. It gives a good result, and I think it's a very interesting and valid technique. What happens? When we started, we plastic surgeons began to apply this technique principle to several patients. What did we notice? For patients who had a heavier face, who had a significant sagging of this more medial portion of the face, who had somewhat firmer skin, this technique didn't provide a result that lasted very long. The result ended up being limited to the period when the patient was still swollen. 4 months, 6 months after the procedure, the patient would start to notice that there was a new sagging of the facial structures. And why did this happen? The more volume you have to pull, the stronger that pull needs to be. And it was from these cases that the technique evolved again. So instead of just making this point, and pulling, we started to detach the tissue and go into the SMS. We detach below the SMS, release the facial ligaments, and then with all these ligaments loosened and the SMS pulled, we were able to apply a slightly stronger traction and pull, and reposition this more medial region of the face. These are the deep plane techniques. Every time we talk about surgical techniques, it's like we're talking about types of cars, So we have those cars that are like SUVs, which are cars that are a bit more robust. These are the sub-SMS techniques. We have those sedan cars, which are a bit bigger, but not really large cars, which would be the plication techniques. Then there are several techniques, There's the mastectomy, there's the Baker, there's the maxi lift, and there are the cutaneous techniques, which are like those old Beetles, like an old car brand, a smaller little car, that wasn't so safe and didn't have much technology. And today we're in the era of SUVs, which are these sub-SMS techniques, where we can achieve a stronger pull on the deeper layers of the face. Within the sub-SMS techniques, we have the HSMAS, we have the deep plane. So there are several variations of the same technique. What's actually done, the name we give to the technique, is really up to the surgeon's preference. So each surgeon chooses the technique that they believe in the most, the one they think will give the best result, the one that makes the most sense to them anatomically. And the type of technique is determined by the patient's case. When we talk about a facelift procedure, it's important to understand that they are not all precisely the same. One particular type of facelift technique is quite different from another, and the aesthetic results also tend to vary. I'm going to explain to you how I see facelift surgery and how I perceive the aging process in my patients. Every time we age, as time goes by, it's not just the skin that becomes looser, it's not just the fat pads that get reabsorbed, it's the whole set of structures that ages at the same time. And these structures, they follow a consistent pattern of aging. So it's very rare for me to have a patient with very thin skin and a very firm SMS. Usually, if the patient has thin skin, she also has a thinner S-mass and more flattening, meaning she has a greater loss of fat pads. So the degree of aging in each layer of the face is proportional and is more or less the same. What changes is the layer in which we are observing this aging. That being said, it is important for patients to fully understand that when we evaluate a patient, we usually start by carefully looking at the patient's skin. But we also assess, right, how those deeper structures are doing. And when we try to rejuvenate someone in order to avoid a stigmatized or artificial looking result, it's important that all the layers of the face are rejuvenated. This is the principle behind three-dimensional facial rejuvenation. We need to improve the fat pads, add volume to areas of the face that are lacking it, lift the deeper structures, and take care of the skin. When we try to rejuvenate a patient and only treat one of these individual layers, the overall result will be more limited, or quite possibly may not look as natural as we would hope. That's why when I perform facial rejuvenation surgery, all patients receive fat grafting and all patients have their skin treated. We don't just do simple lifting. We don't just correct noticeable sagging. We address all the layers and all these aspects of aging. That way, when you approach aging in a three-dimensional manner, you achieve results that are more consistent, more noticeable, and naturally tend to be longer lasting. So this is how I view the aging process in my patients. And every time I choose a technique, to call my own, when I select a technique and decide to start recommending and performing it, I study the principles behind the technique. I understand its logic, and from there, I begin to make small adjustments for each of my patients. When you ask me, doctor, how much does a facelift cost? It's just a guess because, the pricing of any work, any procedure, really depends a lot on the level of complexity and on how I'm going to use a particular tool. It's like asking how much does it cost to renovate an apartment? It depends. It depends on the apartment. It depends on what needs to be done. It depends on the owner's expectations. Then for us, it's pretty much the same thing if we make a rough comparison. So that was the message I wanted to leave with you today, that a facelift is a tool. There are several techniques, right, that can be used, and the results of these techniques vary. They vary according to the type of technique, and of course, they also vary depending on the surgeon's expertise, right?